Hi everyone, welcome back to my channel. This is Dr. Shilpi here, and in today's class, we'll be discussing about the recent COVID-19 situation. And there's a lot of panic that's been going around with the global pandemic. So it was declared a public health emergency of international concern by the WHO, and now it has been declared as a global pandemic recently. And there are a lot of myths that are there when it comes to this situation, this outbreak. So in this class I will be basically talking about the precautions or the do's of the COVID-19 during the COVID-19 outbreak. And I would request all of you to not to fall into the false news or the false forwards that have been going around on the social media about what to do, what not to do, what to drink and all that. I would request all of you to go to the website of WHO for any kind of updates that you need to refer to. And also, if you are in India, you can go to the website of Ministry of Health and Family Welfare, which is updated every day, and it kind of tells you and instructs you on what to do and what not to do during this outbreak. So let's get started quickly with what are the do's in COVID-19 situation for us, the precautionary measures that need to be taken for this during this outbreak. So the first very important thing that we need to follow in this infection is that we need to wash our hands regularly. So we need to wash our hands with soap and water, or we can use an alcohol based hand scrub, because it kills viruses that may be on our hands. So when we are going out, we touch a lot of surfaces, so we tend to, if there is any surface that's contaminated the virus, we tend to pick it up on our hand. So therefore it is advised, as soon as we are entering our house, we need, or we are reaching our offices, if we are still continuing to do so, then we need to go and wash our hands thoroughly so that the virus can be killed. Then another thing is that if we are outside, if we've touched the surfaces, the second most important thing is that if we've picked up the virus on our hand, we should not touch our eyes, our nose and our mouth with our hands. We need to avoid touching, because it can actually make the virus enter into the body. Then another thing that we need to do is maintain social distancing. So at least 1 meter or 3 feet distance should be maintained between anybody who is coughing or sneezing. Even if somebody is not coughing or sneezing, we, as a precautionary measure, we need to maintain that 1 meter or 3 feet distance from each other. Because if somebody is coughing, at that time the small droplets are sprayed through their nose or mouth, and that can lead to that can contain virus and can lead to infection. Then another thing is that we need to practice respiratory hygiene. So during respiratory hygiene is like people who are coughing, sneezing, so such patients need to cover their mouth with a mask, and there's a proper technique of wearing a mask, and that needs to, you can go to the website of WHO. They do explain how you need to wear the mask. Also, you can use, don't fall into the trap of buying the costly masks. You can use the normal mask that we are using in the clinics as well. And the most important thing that we need to follow is, it's very good if we use a disposable mask. And the most important thing that we need to do is, then when we are wearing the mask, we should not touch this part and this part much of the mask. We should actually hold the mask from this side, and we should just push it behind our ears. We need to just slightly hold from here and stretch it towards your neck, and this needs to seal your neck. We need to seal it like this. And after placing the mask, we need to avoid repeatedly touching of the mask with our hands. So that is very important. And during the removal of the mask, you need to touch it from here and not touch it from anywhere else, and discard the mask from here. And also the next thing is, if you are suffering from any kind of fever, cough, or if there's any difficulty in breathing, you need to seek medical care as early as possible. Then another thing is, if you have recently visited some place or have traveled internationally, then you need to isolate yourself or self quarantine yourself. And if there are any kind of symptoms that you see, then you need to seek medical care as soon as possible. And another thing is that we need to avoid shaking hands with each other, because there are high chances that we transmit the virus in such way. Also, in the recent studies, like it has been seen that the virus can stay for a long time on the plastics, on metal and glasses. So we need to avoid touching the surfaces as much as possible. And if we are touching a lot of surfaces, we need to wash our hands repeatedly. So these are the two things that we need to follow vigorously. And also we need to stay informed, and we need to stay away from fake news. And therefore I would request you, for any kind of updates, you can refer to the WHO website, or if you are in India, you can refer to the Ministry of Health and Family Welfare website. So stay informed, take care of yourself, and stay safe. So that brings us to the end of the class. Thank you so much for watching. Stay safe. Thank you.